Hi, Dr. Kwangat and Les. May I get a mic check and a video check when you have a moment, please?
Check 1, 2, 3.
Check 1, 2, 3.
Thank you very much. You both look good. We will be starting as soon as the rest of the panelists log on, which will hopefully be in the next 2 minutes. Hello, Andrew. May I please get a mic and video check?
You can. Can you hear me now?
Yep. Easy peasy. Thank you.
Perfect.
Thanks to all the reporters who are already logged in. It is now 10 a.m., but we are still waiting for 3 panelists to log on, so we will be beginning shortly. We appreciate your patience. Lacey, may I please get a mic and video check?
Good morning.
Perfect. Thank you very much. Hi, Michelle. May I get a video and an audio check, please? Good morning, Dr. Shaw. May I get an audio and video check?
Good morning, Julie. How are you? 1, 2, 3.
Thank you very much. I can hear you loud and clear. We will be beginning in about 90 seconds. Good morning, everyone, and welcome to the Wednesday, November 17th COVID-19 response media briefing. I'm Julie Grauert, your facilitator for the event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair Shah, Secretary of Health, Dr. Tao Kwanget, Chief Science Officer, Michelle Roberts, Acting Assistant Secretary, Lacey Fehrenbach, Deputy Secretary for COVID-19 Response, Andrew Rose, COVID-19 Incident Manager, and Les Becker, Deputy Secretary for Innovation. To begin today's briefing, we will open with remarks from Secretary Shah. Go ahead.
Thank you, Julie. Thank you for kicking us off here, and good morning to all of our media partners. I just want to thank you again for just continuing to be with us throughout these many months that we've had these media briefings, and we hope you find them useful. We know that also we had a media briefing last week, but with the Thanksgiving holidays next week, we thought it was good to move this up. So we also appreciate the fact that not only have you been with us all these months, but you were flexible in joining us this morning as well. I want to start by acknowledging the atmospheric river response activities across Washington, especially in Northwest Washington. We really want to, first of all, say that our thoughts and well wishes go out to all those who have been impacted in communities across Washington. This has not been an easy time, and we know that this is an especially difficult time in many communities across Northwest Washington. Our department has been actively engaged along with other state agencies. It's just a reminder that public health remains as first responders. We've been working on coordination of vaccines and working with our healthcare partners and other local health partners on the ground. And I just want to say thank you to all our first responders who have just done such a tremendous job in all fields to make sure that people are safe and protected during these very difficult times. Andy Rose is here. He certainly is, you've seen him before. He's going to be able to answer some additional questions about the response. And I just want to, again, thank everybody for helping keep people safe during these very difficult times. I'm also cautiously optimistic about what is our current situation related to COVID-19, and we will get through some of those numbers a little bit later, but just in summary to say that this is a really important time for all of us. We know the holidays are right around the corner. We've seen decreases in our state when it comes to cases and hospitalizations. We've started to see some flattening of that or decrease of that slope, if you will, on the downside, as well as we're seeing what's happening in other states across the country. And so it is absolutely critical for us as we get into the holidays that we continue to do everything we can to get vaccinated, help our families, including our kids, get vaccinated, and certainly even the issue around boosters. And then finally, to make sure that we are continuing to mask up, especially if we're planning on doing travel or having gatherings around the holidays. But this is exciting time because we do have pediatric vaccines in our community. And some of you may have seen on social media that I had a 5-year-old that turned 5 yesterday, and his birthday was very happy. He was very happy with all the excitement that was in the home. But tomorrow, he, as well as our 7-year-old, 2 boys are going to be getting their first shots tomorrow afternoon, and I'm going to be joining them to get my booster as well. So I just want to say what a great time it is, what a tremendous time it is for all of us to get excited about the future, and hopefully we can start to see the pandemic in our rear view mirror at some point, but certainly we're not there yet. So please keep working with us. I'm going to now transition to Michelle Roberts, who's going to give some additional details about vaccines. And then certainly and then Lacey Fehrenbach is going to talk about some additional COVID-related information, which I think is going to be really instrumental. But I did want to introduce 2 individuals who I have not had a chance to introduce on the press briefing before. One is Dr. Tao Quanget. Dr. Quanget is our new Chief Science Officer, and he started full-time November 1st, and I will assure you he has hit the ground running, and he has been doing a tremendous job. He comes to us from previous work in public health, but also in the private sector. He's a pediatrician by training, and he's very, very well regarded in not just the medical, but also the public health communities across the state of Washington. And so excited to have Tal join us, and he is going to be describing some additional information related to pediatrics and vaccines, et cetera, related to COVID-19. So Tal, thank you for that. I wanted to make sure to welcome you to our team publicly. And then Les Becker, our Deputy Secretary for Innovation and Technology. Les has also hit the ground running. He's been with us for a few months, and most recently he's been working with Michelle on WA Verify, and we're going to have some news about that as well. And Les is really leading our efforts in not just technology, but also innovation, and really an incredibly important part of our reframed look at how do we see public health for the future. So Les, welcome to the team as well. And then I'll come back with some additional comments at the end. So with that, Michelle, I will turn it to you.
Well, thanks, Dr. Shah, and officially welcome Les and Dr. Quanget. We're so glad you're part of our team, and all of us are really thinking about the communities most impacted by the weather events we've had and are standing by to help them. So as you all know, I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. I'm really happy to share that we continue to make progress every day, getting more people vaccinated and protected against COVID-19. 80% of people age 12 and older have received at least one dose of vaccine. So thrilled we've crossed that 80% mark, and more than 73% of that age group is fully vaccinated. We're also now starting to get a better look at the number of kids who are getting vaccinated across our state, which is information that will be added to DOH's data dashboard website soon. Since eligibility expanded earlier this month, more than 60,000 kids between the ages 5 and 11 have received their first dose of Pfizer vaccine. What's great is our pediatric vaccine supply is also increasing every day, which means it's becoming easier for families to find vaccine locations near them. To date, we've ordered about 500,000 doses of pediatric vaccine, which includes an extra 50,000 doses we specifically requested from the federal government to help us keep up with demand. There couldn't be a better time to get your child vaccinated. If they get their first dose this week, they'll be fully vaccinated before the new year and much more protected from the worst outcomes of COVID illness. To schedule an appointment, you can reach out to your child's pediatrician, your healthcare provider, your local pharmacy, or mobile clinics. To find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. Type in your zip code, and at the top page, you can filter results to show Pfizer pediatric vaccine locations near you. If you have questions or need help, anybody can call the state's COVID-19 hotline at 833-VAX, V-A-X, HELP, H-E-L-P, and they can help you schedule an appointment or also get you to information if you have any questions. I'm going to switch now and talk a little bit about booster doses. So across the state, more and more people are getting their booster shots, further protecting themselves from getting sick. What we know is that more than 820,000 people have received an additional dose of COVID vaccine, and that includes both booster doses and third doses. We've recently been getting some questions about who should be getting a booster dose right now. People age 18 and older who receive the Johnson & Johnson vaccine should get a booster dose at least 2 months after getting the first dose. So that is all people age 18 and older who receive the J&J vaccine should get a booster dose at least 2 months after their first shot. For those who've received Pfizer or Moderna, it's recommended that you should get a booster at least 6 months after completing your primary vaccination series. If you're 65 and older, if you're 18 and 64 and through age 64 and live in a long-term care setting, or you're age 50 and older with an underlying medical condition that puts you at an increased risk, or that you're at an increased risk of social inequities. There's other groups that may receive a booster dose, including people age 18 to 64 with underlying medical conditions or who are at increased risk of social inequities, or people age 18 to 64 who live or work in high-risk settings. These recommendations are broad, so any individual can assess if they're at increased risk because of a health condition or because of their job or living situation. And those people and any of us can self-attest that we are eligible. And then furthermore, if you're still unsure if a booster dose is right for you, you can talk to your trusted healthcare provider. We expect booster dose recommendations to continue to evolve at the federal level over the coming days, and we'll keep everybody updated if there is any changes. So in closing, if you have any questions about the COVID vaccine, please visit the Department of Health's Frequently Asked Questions page. We also have a new section there about vaccinating youth. And if you haven't been vaccinated yet, it is not too late. If you receive the J&J vaccine, you'll be fully vaccinated by the December holidays. And if you get a 2-dose vaccine, you'll be fully protected and ready to ring in the new year safely with family and friends. Thank you.
Thank you, Michelle. We go now to Lacey. Go ahead.
Thanks, Julie. Good morning, everyone. Lacey Fehrenbach, Deputy Secretary, COVID-19 Response. Appreciate you being here today. The Department of Health is going to be adding 2 new sets of vaccination data to our dashboard soon. The first is vaccination data for children ages 5 to 11 with the recent recommendation of the Pfizer vaccine for younger kids from the FDA, CDC's Advisory Committee on Immunization Practices and the Western State Scientific Review Work Group. We are looking forward to sharing our coverage rates for this age group as we do with other eligible ages, and seeing the progress as across our state as kids initiate vaccine and become fully vaccinated in the weeks and months ahead. So a bright spot in addition to our dashboard. The second is that we will be adding additional COVID-19 vaccine doses administered or boosters. So this includes both 3rd doses, which are recommended for people who have certain conditions and are immunocompromised, and also booster doses for all eligible populations. An additional dose is given to someone who has completed their primary series and is considered fully vaccinated. So this update will not impact the rates of people who initiate vaccine or are considered fully vaccinated on the dashboard. It will be showing 3rd doses or additional doses. These changes will be added to our dashboard within the next week. The second thing I want to talk about is testing. We know that many are looking forward to travel, seeing friends and family, and it's possible this year and safer this year thanks to vaccines, the strongest protective measure we have against COVID-19. However, testing is another critical tool to help us keep ourselves and our loved ones safer when we travel, gather, or celebrate. First, let's start with people who have symptoms of COVID-19. If you're sick or have been exposed, get tested regardless of your vaccination status. If you're sick, even a little unwell, please don't travel or go to see others, and just stay at home and get tested. If you develop symptoms during your travels, isolate away from others and find a test locally or use an at-home test. And if you come home and you're sick, stay home and get tested. So bottom line here, if you're sick, stay home and get tested. For those who are well and need proof of a negative test for travel or for large events or other activities, the really critical thing is that you plan ahead. Start by reviewing the travel requirements or local policies where you're going carefully to make sure you understand all of the requirements and necessary documentation. It does vary by jurisdiction. For example, some destinations require a certain type of test, such as a PCR or molecular test, while others will allow either an antigen or a molecular test. Testing providers won't always guarantee results in certain time periods for travel or events, so you could consider finding a point of care molecular or antigen test as allowed. These types of tests that are administered at point of care are still interpreted by a provider, but they can typically provide results in as quickly as 15 to 20 minutes or within a few hours, depending on the test. Some testing sites may prioritize their testing for people with symptoms or symptoms of COVID-19 or who are close contacts. So just be aware of that. And then also know that you could be responsible for the cost associated with testing if it's for travel purposes. Insurers are not required to pay for tests that are required for travel. Some may. You should check with your insurance company if you're worried about whether or not you'll be charged. Lastly, for less official needs like family gatherings or other holiday get-togethers, over-the-counter at-home tests are a great option ahead. These are relatively low cost. They won't require an appointment. You don't even have to leave your own home. Plus, the results are typically ready in 15 minutes or so. The at-home over-the-counter tests are also a great option for personal or family use if you start feeling a little icky or unwell on your travels or after you return home from a trip or gathering. They're available at local pharmacies and through a number of online retail outlets. The bottom line is if you're ill, don't guess, take a test. And if you need documentation, plan ahead so that you have what you need to get into the big game or onto the plane. We want your event to be uneventful in that regard. I'd like to conclude with just a Thanksgiving message to each and every one of you. We know that it's been a long and difficult journey through this pandemic, and it has required so much by so many. Healthcare workers, public health workers, first responders, education leaders, the journalists and the media, parents and caregivers, community and faith leaders, business leaders, just to name a few. While we know we're not yet out of this pandemic, we are grateful for everything you have done to keep yourself, your family, and our communities safer and healthier in the most challenging of times. With that, thank you, and back to you, Julie.
Thank you, Lacey. We go now to Dr. Kwan-Get. Go ahead.
Good morning, everybody. My name is Tao Kwan-Get, and I'm very happy to be talking to you today. As Dr. Shaw mentioned, I'm the new Chief Science Officer for the Washington Department of Health. Before joining the Department of Health in October, I've worked as a communicable disease epidemiologist, taught and done research in public health, and worked for many years as a primary care pediatrician. One of the most important responsibilities of primary care providers is making sure that their patients are fully immunized. So I'd like to talk this morning about the importance of getting vaccinated. Getting a COVID-19 vaccine is very important. And it's also important to remember to get up to date on routine vaccinations and influenza vaccine. The pandemic has caused many people to delay getting checkups for themselves and their children. And checkups cover so many important health topics, such as healthy activity, healthy nutrition, developmental screening for children, and vaccination. So this year with the pandemic, we've seen a slowdown in kids getting immunized against vaccine-preventable diseases such as measles, chickenpox, whooping cough, HPV, and meningitis. So as a pediatrician, I just want to emphasize how important it is to make sure that kids are getting their regular well-child visits and staying up to date on these important vaccines. This means getting this season's flu vaccine as well. The flu is a highly contagious disease that can cause mild to severe illness and sometimes lead to hospitalization and death, especially in the very old and the very young and those with pre-existing health conditions. But even in healthy people, influenza can be a serious life-threatening illness. Flu vaccine is the best way to prevent getting the flu, and we want people to remember how important it is to get your flu shot. Everyone 6 months of age and older should get their flu shot this year. It's vital to make sure everyone in the family is vaccinated against influenza because it's an important way of protecting the elderly as well as people of all ages with chronic conditions. And the more cases of flu we can prevent, the better off our healthcare system will be. The fewer people who are sick, meaning the fewer people who need to go to the emergency department, meaning the fewer people who need to get hospitalized, and that will reduce the stress on our healthcare systems, which we anticipate may already be severely strained by COVID-19 this year. So remember, one of the best things you can do to protect yourself and your loved ones this year is get vaccinated. It's a win-win situation for you, your family, and your community. Thank you. Back to you, Julie.
Thank you so much, and very happy to have you. Let's go to Dr. Shaw now before we take our reporter questions. Go ahead.
Great, thank you, team, for providing such important updates. And I will just underscore what an important time this is. We absolutely are excited to see kids getting vaccinated, as Michelle mentioned, 53,000 and counting 5 to 11-year-olds that have gotten their vaccines. Their parents have helped them get their appointments and gotten them to be protected. And so that's fantastic. We're so excited to see that. And if I could start with having, I'm going to ask for the epi curve, and then I'm going to ask for the booster slide graphics, if you don't mind. With the epi curve, this is really important for us to continue to see this, the news, which is, overall still in the right direction, which I think is the key message. We have continued to see a decline in cases and hospitalizations. But I think the key message, if you could go back to the cases, is that if you look at where we are with this epi curve, again, where we are in November of 2021 is actually very similar to where we were in November of 2020. And if you remember, at that time, we had started to see an increase, and that increase then led to our third and a very sustained wave over the holidays. That is the caution that all of us have. And when we're seeing, as was mentioned, across the country, we're seeing some uptick in certain states in the Midwest and the Mountain West states. We are concerned that if we do not continue to get people vaccinated and people to take the appropriate precautions, that very quickly this trend that's going in the right direction, while it has slowed a bit, it's still going in the right direction, that what we do not want to see is that this leads to an uptick into a sixth wave. And so that is really critical for us to continue to do everything we can. Yes, cases and hospitalizations are down and they are going in the right direction, but they remain at very high levels. And I think that is really the same thing that you're seeing on this graphic with hospitalizations. Again, it's nicely coming down, but as you can see that we've started to see a little bit of a flattening and even some modeling showing perhaps a slight uptick. And what we want to do is to continue to see that come down. We have a very similar thing with deaths, that we have seen a steady decline in deaths, which has been so critical for our protective measures to make sure that we do not see people who are severely impacted by this disease, but still they're higher than what we would like to see. So I think the key message from us is that, yes, we're going in the right direction, but it's because we have these policies in place related to masking, and people are rolling up their sleeves to get vaccinated, people being very careful, and there is a tremendous amount of efforts in our healthcare system and our approach to how we can support our healthcare system, which continues to remain strained right now, as you heard from Dr. Kwan-Get. The other piece that I would wanted, if we could show the booster slide again, I'd like to talk again about how Michelle described this. Again, more than 820,000 additional doses have been given out across Washington, and this includes booster and third doses, which is fantastic. But we all know we want to see more people get their boosters. If we can go to the next slide. And if you could bring up the conditions, that's what I was really looking for. I wanted to take a moment for all of us to look at this very carefully. As Michelle mentioned, that when it comes to considering whether it's time for you to get your booster, obviously there's a time limit, more than 6 months after the mRNA vaccines, Moderna or Pfizer, or 2 months after the 1-dose J&J vaccine. But the way our federal partners have written the guidance, it is very clear that they have said two things. One, that if you are in certain categories, as Michelle went through, you should get a booster again after 6 months post your mRNA vaccines. Or if you are in a different age category, 18 to 49, that you may get a booster. And in fact, we know that there are going to some states that have moved forward with this consideration this week, and certainly we are watching what's happening at a national level. The FDA and CDC ACIP committee will be meeting Thursday and Friday respectively, and we're watching this very closely. And what I want to emphasize in the meantime is that if you're 50 years of age and above and you fall into any of these medical conditions, we absolutely want to make sure that you are seeking your booster again 6 months after your primary vaccinations for mRNA. If you, though, are 18 to 49, we also want you to talk to your healthcare provider. This is a time that we want to make sure that you look very carefully at those conditions. And you may be surprised by some of these conditions that obviously we all think about are, immunocompromised states like cancer or HIV infection, anywhere where you have a weakened immune system, chronic kidney disease, chronic liver disease, chronic lung disease. But I also want to make mention of conditions such as dementia, mental health conditions such as depression, being a current or former smoker, if you're pregnant, diabetes, type 1 or type 2, heart conditions. There are a number of different conditions that put you at higher risk. And so if you are uncertain, we are going to say, please talk to your healthcare provider. And why I am emphasizing this so much today is because Thanksgiving and next week is right around the corner. And we want to do everything we can for people to be protected when they are traveling, when they are gathering, when they're doing whatever those activities are over the holidays. As Lacey very nicely has stated, we are so thankful for being where we are as a nation, for being able to fight this pandemic. And we know Washingtonians are tired of this pandemic, just as all of us are. However, there is still risk if you are not vaccinated. We want people to understand that risk. Traveling, gathering, families that may have people who are not fully vaccinated, who are coming together, those are people who may be putting themselves or others at risk. And so you may have seen Dr. Fauci nationally had said that families that are fully vaccinated can feel good about gathering. And I would just underscore that anybody who is fully vaccinated should feel good about being fully vaccinated. But we also recognize that with waning immunity, there may come a point where you need to get a booster vaccine. And if that's the case, if you're in the category right now, if you're should be getting a booster, please get the booster. If you're not in that category, but you are thinking you might be, or you want to have you have a question about whether you are or not, or what you should do, please talk to your trusted healthcare provider. That is the key message. That's what we're trying to say. Please do not underscore in a negative way the fact that boosters are going to be very helpful to all of us moving forward. Again, we're going to watch what our federal partners will be doing with FDA and CDC later in the week, and we will continue to update any guidance that we have. At this point, again, our guidance is if you are in the categories that you should get a booster, please get the booster. And if you're in the categories where you may get a booster, please contact your healthcare provider at a very minimum. The final thing I'd like to do is to talk about WA Verify, and I just want to say that we're continuing to enhance WA Verify, and it's a tool that people can use. We know there's going to be more to come next week. This is maybe a little bit of a look ahead here, that WA Verify is as background, is our new digital COVID-19 verification record tool. And this is for community members that can use it. They want to provide a digital version of their vaccine verification. It is not the only option, but it is an option. You can certainly still have your paper card, and you have other ways of showing verification. But with this tool, people can use the tool to get a link to a QR code and a digital copy of their verification record, which they can certainly then save to their phone or take a picture of or print if they would like. This tool can be found at waverify.org. And I do want to make sure everybody recognizes that we're going to be sending out more information about this likely next week. Again, we're still making sure that all the systems are working appropriately, but we wanted to at least let everybody know how they can begin accessing WA Verify if they want to use this as a tool option. The final thing is that we are closing in on Thanksgiving and the holidays, and this has been a tremendously difficult time for all of us. And we want you to continue to know that we are there for you, with you. We know that there are other trusted providers, healthcare providers that are there. There is information that we have provided also for emotional support for folks as they're coming to the holidays. This can be a very difficult time, especially with people who may have lost loved ones this past year, year and a half, 2 years because of this pandemic. We want to make sure that people are just coming together to be thankful for what we all have, but also to be thinking about how we can support each other. Check on your neighbor, check on a family member, check on someone, make sure you do it safely, but check on someone who ultimately may also be needing somebody to reach out to them. And we want to make sure that you're there for them as we should be for each other. So with that, I'm going to close and say thank you again to our media partners. And Julie, we'll turn it to you for Q&A.
Thank you, Dr. Shah. We have 6 reporters in the queue right now and 27 minutes left in the briefing. So we'll start things off with Ariel from the Spokesman Review. Go ahead.
Thank you. I have 2 booster related questions. And the first one I think you've confirmed, but I just want to solidify it. Is the Department of Health considering doing what California and New York have done, where they just open up boosters to all eligible adults? And then I'm hearing from some readers that they're not allowed to mix and match booster doses, as some providers won't do that for them. So I'm curious if that's at DOH's direction or sort of what the guidance is when it comes to which booster folks get. Thank you.
Yeah, thanks, Ariel. Thank you for those 2 questions. I'll let Michelle catch the second part of that. Just to reemphasize, we are watching what's happening in other states and other jurisdictions. You mentioned one of them. There are a few other states that we're also very much in touch with and connected with what they're doing. As I mentioned, tomorrow the FDA is meeting and the CDC ACIP committee is meeting on Friday. We do think in the next couple of days, there likely will be some updated guidance from our federal partners. We're continuing to stay with the current guidance, but we want to make sure that we clarify for people. Ariel, this is so critical. And that's why I went through those conditions in such exhaustive length here. We want to clarify for people who may already be eligible for boosters, but just have not gotten their booster. Again, we've had 800,000+ people who have gotten either a 3rd dose or a booster dose, and that's great. But we also recognize that there are additional people that may be in consideration. So again, if you are in the should category, please get your booster today. Do not delay. And if you are in the may category, please understand what that means, your individual risk, and certainly contact your healthcare provider. And that's key for making sure that we are staying connected. And then the reminder about the time element of J&J 2 months prior, if that has already passed, we want to make sure that you get your booster, as well as for Moderna, Pfizer 6 months. But we have been very clear about mixing and matching. And that is really something that Michelle can talk specifically about. But from our standpoint, mixing and matching it should be allowed. So Michelle, let me turn it to you.
Yeah, mixing and matching is definitely allowed in the clinical recommendations and the information we're sharing with providers. Individual situations may be based on a provider recommendation, but also depending on where they're going. It's just because mixing and matching is allowed, it doesn't mean an individual provider will have all 3 types of vaccine available, especially if you're going to a mobile clinic. A lot of times mobile clinics reduce the different amount of vaccine they have there, and same thing in a provider office, just to prevent medical error. So everybody can talk to their healthcare provider about which booster type or which vaccine type may be the best for their to get for their booster, but there's really no problem with getting any of the vaccines for your booster. So some of that, and if you have talked about wanting a specific vaccine, you may have to try a couple of places just depending on what availability is. But luckily, our vaccine finder on our website, that's one of those things you can filter for by type of vaccine, and that can help you find where a specific type of vaccine may be available.
Great, thank you. Our next question comes from Joey with the Puget Sound Business Journal. Go ahead.
Hi, thank you. Back to Verify. I know it's a sort of a soft launch, but what has the outreach been to businesses? I know everyone's kind of figuring out, which forms they're going to accept. So if you let folks know this is what they should be expecting, and also it's a QR code. Is there like a scanning app that businesses are supposed to be using, or what's the purpose of the code?
Joey, thanks for that question. And this is great that we have Les Becker on, because we will turn the two questions to him. And again, one of the reasons that next week we're planning on doing a more robust launch is to be able to get information out, but also get information out to the appropriate partners out there as well, including our business community. So with that, Les, let me turn it to you.
Thanks, Joey. That's a great question. And we have been working with many of our partners on the private sector side about how this will roll out and how it will work within their businesses. And as Seattle-King County went out with their mandate, we provided a lot of this information. And I know they shared it with many of the chambers and other business entities within their jurisdictions. And we'll have more on this to come as the rollout continues for Verify. On the other question about the app, this is an immature space for the technology side of things. And there are many companies that are out there building apps and other entities that are looking at private sector solutions to do this verification. We have pointed people back to the Commons Project Smart Health Reader app as the one that we have reviewed and feel comfortable that it is a private option that allows privacy for the consumer, but also handles the business side and allows them to do the verification in a quick and easy way. We'll continue to monitor that space for other apps as they come online. And we are also working with several other state partners on how their apps are being developed to do this reader. And we'll continue to update everyone as we move forward with this journey as well. Thank you for the question.
Thank you, Les and Dr. Shaw. Our next question comes from Jake at King 5. Go ahead.
Morning, everybody. Thanks for the briefing this week. I'm curious how much thought has gone into more potential goal setting in terms of reinstating similar goals we set early on in the pandemic in terms of reaching benchmarks where possible mandates could be eased or lifted. I know in the past, an answer to this question was, we don't want to lift any of our mandates that have gotten us to this good point, but I'm just wondering how much thought has gone into that kind of goal setting. It's a question that we hear quite often from viewers. Thank you.
Yeah, Jake, I'm going to turn that to Lacey in just a moment. I would say that we have actually been behind the scenes doing that very thing. Is we're looking at not just where we've been, but we're also looking at where we're going and forecasting and modeling. And so that includes, again, as you can imagine, a number of different elements. That includes our community cases and numbers, but also what's happening in our healthcare system. Ultimately, our healthcare system is a critical aspect of this. We know that given where we are, usually if you didn't have a pandemic in the state of Washington, when winter comes, it becomes tremendously challenging in our healthcare system with resources and capacity being strained. And so we're really looking at that very carefully. The other piece of this, obviously, is that I do want to emphasize that there are not as many you use the word mandates, and I would say that we're really also shifting to thinking about what are the things that we can do, which we currently have already been doing, on how we stay open while we're also staying safe. And those protocols include, look, businesses are open, but we're saying wear a mask indoors. But those are the kinds of things that we are very much mindful of, but also very different than the time element earlier in the spring when obviously we were looking at reopening, but things were closed. So I hope that helps a bit. I know it's a general answer. Let me turn it to Lacey if she has some more to add to this. I guess the last thing I would say is that we are going to continue to look at this very closely with the governor's team, as well as our partners at state agencies, so we can continue to come up with what are those appropriate goals that allow us to safely remove some of those requirements. But right now, again, just a reminder that there aren't as many of the so-called mandates that you refer to that were there in the spring as we're talking about now. Lacey.
Thanks. I will just add, I know that people want, and they want, first of all, that hope, and people are tired of wearing masks. We recognize that. I do want to say it's not forever. And also the challenge we're navigating is making these decisions is extraordinarily complex. We're looking at things that you all see and report about all the time, things like disease rates, case rates, hospitalization rates, death rates. And then we're also looking at hospital occupancy and generally and due to COVID. The other element we're constantly monitoring is the circulation of variants of concern and variants of interest in our state, nationally, and globally. Right now, it's almost all Delta across, all three levels. So I don't know, to Dr. Shaw's point, we are absolutely in conversations with the governor's office, our partners at CDC, our partners in local public health, about how we navigate to a different place in the pandemic. And I don't know that it will be a single metric. It's a combination of things. And, I failed to mention vaccination rates among them. So we understand the public wants this information. We understand people want a path forward, and it's not a simple answer.
Thank you. Our next question comes from Jessamine at Q13. Go ahead.
Good morning, and thank you again for the briefing. I hope you all have a safe and happy Thanksgiving. If we don't talk to you before then, I have a few questions. One is the Seattle Public Schools are meeting today, and one of the discussions that they will have is whether or not to add the COVID-19 vaccine to the mandatory vaccination list. And I want to know where the state stands on their recommendations for that, or if you're still following federal guidelines when it comes to it. And also when it comes to the boosters, just because it gets there's a little confusion, because with the mRNA vaccines, we can clearly hear that there need to be underlying conditions, but with Johnson & Johnson, it sounds like there doesn't. So if we could just get a little bit more clarification on who should be getting those, are there underlying conditions that are necessary for those 2 months out of a J&J?
Yeah, thanks for that, Jessamine, and happy Thanksgiving in advance to you as well. I'll let Michelle and maybe Dr. Quanget speak to that last question. When it comes to the education, what you refer to with the education system, looking at what are potential requirements. We know that the State Board of Health is looking at this as well. And we also, Dr. Quanget is going to be co-chairing a group out of the Board of Health to look at this very issue about requirements for COVID vaccines in schools. That group has just formed, and it is really actually, I believe that just the co-chairs at this point have been named. And so there's a process that's going to be beginning with that. And so I think this is really looking at, again, all the science and all the evidence that's out there, and really looking at this from a standpoint of what is going to be protective for our kids to make sure we can continue to assure that they're going to be safely in person in schools. And we are watching that very carefully. And so, at this point, our state stance is that we are doing everything we can to make sure our kids are safely in person in school. And that includes masking indoors, that includes the vaccine requirements that have been in for K through 12 staff, and also the question of how do we look at vaccines for children. Again, the Board of Health is looking at this issue. We continue to be in contact with them. Dr. Kwan-Get is going to be part of that process. And again, we continue to follow what's happening with science and information across the country, and certainly how that impacts us here in the state. So Michelle and Tal, I don't know if you wanted to add anything to what I just said on that, that's great too. But Michelle, do you want to just talk, Michelle or Tal, on this booster issue, J&J?
You want to start, Tal, or I can.
Yeah, go ahead, Michelle. I'll go after you.
I mean, I think I missed the specific question, but I will say that, so if it is something specific to J&J, but it is different between the mRNA vaccines and the Johnson & Johnson vaccine. And we understand that these recommendations can be, that they have, the way they've rolled out at the federal level, created just a little bit of confusion because it differs by vaccine and it differs by age. But for Johnson & Johnson, it is anybody who got Johnson & Johnson vaccine who's over age 18 and it's been more than 2 months should be getting a booster dose. And that really is the best protection. And I think one of the things we're learning as these vaccines are in use is many different types of vaccines require multiple doses. And that's part of what's being learned here in real time. And so we would really encourage anybody who got J&J to be getting a booster dose as long as it's been at least 2 months since your last vaccine.
And to clarify, Michelle, a booster dose doesn't mean a booster with J&J. In particular, it can be any of the vaccines, including
back to the
Pfizer.
Allowance of mixing and matching vaccine types. J&J vaccine recipients are eligible to get an mRNA vaccine as their booster, and they could also get a J&J dose as their booster. You know, the data on which type of vaccine and what combination is very, very preliminary, and there's not a recommendation about which type of vaccine to be getting as your booster dose. And if you're confused, we really would recommend talking with your healthcare provider if you have any further questions.
Yeah, I think the only thing I would add is that I think the original hope with the Johnson & Johnson vaccine is that just a single dose would provide adequate protection. But with time and experience with the vaccines, we've seen that a single dose does not provide as good a protection as the 2-dose mRNA vaccines. And so the universal recommendation for everybody who's gotten a single dose of Johnson & Johnson vaccine to get a booster is an attempt to bring up the protection for those who got Johnson & Johnson vaccine to a level that's comparable to the mRNA vaccines. With regards to the technical advisory group, this is a part of a very established procedure for determining what vaccines should be required for school entry. There's a very specific list of criteria that involve looking at the risks, the benefits, as well as the scientific data. And so when this group will be convened, we will faithfully stick to the criteria and the process that's been done before, so that Washingtonians can have a lot of faith that the decision whether or not to require COVID-19 vaccine for school entry will be considered in a very in-depth and thoughtful way.
Thank you. Our next question comes from Daniel with the Inlander. Go ahead.
Yeah, so mine's a little bit of a follow-up to the question about, I'm just kind of been looking at the question of, kind of how we unwind some of these mandates a little bit more. And I guess I had two kind of pieces to that. One is, we talked about eventually lifting mask mandates. Do you expect existing COVID-19 vaccine mandates to be lifted as well sometime in the future? And also, to what degree is the new Pfizer drug, which looks to be incredibly effective in treating COVID if administered in the first 5 days of infection, to what degree is that part of the calculus in deciding whether to lift some of these mandates?
Yeah, I'll take a stab at Daniel, I'll take a stab at that, and I'll turn it to maybe Lacey and even Tao if he wants to add something to this on the antiviral piece. I would say that right now we remain concerned about where where our numbers are. Again, trends are going in the right direction, but our numbers are very similar to what we were seeing at the beginning of our third wave back in November or the fall of 2020. And so numbers are still very high. And so, I'm really hard pressed to think about a scenario where you would see the numbers be so dramatically decreased to the point where we're not concerned with the fall, winter season coming, flu season coming, and obviously still uncertainty related to vaccination efforts across the country and in our state for those who have not gotten their primary vaccines. And again, a reminder, if you haven't gotten your vaccine, even one dose, please get it today, or booster or additional doses. And so I think there remains quite a bit of uncertainty when it comes to all of those factors being brought in the midst of where we are. And so, we want to continue to see these safety measures, these protocols in place, doing activities, being able to do things, but also to do them with safety in mind. And again, it's the same thing with Thanksgiving, that, we want people to enjoy Thanksgiving and the holidays, but we want them to be safe in the process. And the last thing you want to see is that we start to pull some of these measures back and those increases go back up. And now we're in a point where cases and hospitalizations in the midst of flu season and winter, that now we're looking back and saying, gosh, we could have prevented that from happening in the first place. So I don't see that happening right now. And, to be very frank, I would have to see a lot more, incredible amount of movement to feel comfortable with making that kind of a recommendation. And I just don't see it happening given where we are. If we had seen across the country an incredibly curves going down, if we didn't see things happening across the globe and in Europe, for example, where things are going up, and if we also didn't have experience here of having 5 waves, I would feel markedly better about this. But right now, I just feel this is not going to be the time. So we've got to just hang on and continue to do the things we know that work, staying safe, and those protocols are going to be so critical to what we do here moving forward. So Lacey, Tao, I don't know if you wanted to add anything to that.
I can quickly add, we are excited about the possibility of these antivirals coming online. Both still need emergency use authorization from the FDA. There's one of it that has been submitted by Merck and one from Pfizer. They do reduce severe disease, so they don't prevent infections. We still, would have the vaccine as the strongest protective and preventive measure, but they will help prevent severe disease, and that will help us make progress on our goals. And I just want to refocus us on what our goals are. So we're trying to prevent severe disease and death from COVID-19. We're trying to keep our economy open, as Dr. Shaw said. We're trying to keep our schools open, and we're trying to keep the healthcare system prepared to handle people who need care for COVID and any other emergent health need. And right now, if you look objectively at our metrics across, we're in a very tenuous place. Our hospitals are at about 90% occupancy. Antivirals will help us bring that down when it comes to COVID and when they come online. What we don't know is how soon that will be. We think it will be within months, maybe within weeks, that we'll start seeing them. But as you will recall, many things as they come online are usually in pretty limited supply initially, and then production ramps up and they're more available over time. So remains to be seen. It is certainly a great development in our fight against the pandemic that we can layer in with our other existing tools, and certainly something we are thinking about and looking forward to.
I think the only thing I would add is that, yes, these new antivirals have the potential to be a really powerful tool to reduce hospitalization and death from COVID-19, but still vaccination is the best way of getting protected. So these antivirals may be somewhere between 50, 70, 90% effective at reducing your risk of hospitalization, once you get COVID-19. But if you get vaccinated now, that can reduce your risk of getting COVID-19 by 5 times, can reduce your risk of hospitalization and death by more than 10 times. So it's much better to get vaccinated now for people who haven't already than to wait for the advent of these antiviral medications.
Thank you. One more reporter has joined the queue, so we now have 2 reporters left, which means we'll likely go a few minutes over, just for your information. Our next reporter is Kate from KUOW. Go ahead. Stand by, we are trying to unmute her. All right, while I work with Kate on working on her tech, we are going to go now to Elise from the Seattle Times. Go ahead.
Hi, good morning. Thanks so much for the briefing today. Last week, Dr. Lindquist, I think, mentioned the continued high hospital occupancy was partially due to the recent increase in some of these other respiratory viruses, not just COVID. So I'm wondering if the state can give an update on where we stand in regards specifically to the flu and RSV and how those recent trends might compare to past years. Thanks so much.
Yeah, Elise, thanks. I'll take a quick stab at flu activity. I was looking at this just yesterday, and Dr. Kwanget, I'm sure we'll have more information about flu and RSV and other respiratory diseases. So we have, last year when we were at this point, we really were seeing no flu activity. Right now we're seeing low flu activity, which is great. It's better than, seeing markedly higher numbers, but there is flu activity happening. And if I could maybe just take some conjecture here, is that I would think that part of this is that last year we were doing a lot more universal masking across the board, and we were at a very different place in our state. Even some of the gatherings were not happening, and people were really staying at home more than they are now. People are out and about, which is great, but at the same time, that along with not wearing a mask, in settings, yes, it's about fighting COVID, but the secondary benefit last year was that you really had a very, very mild flu season across the country. And this year we are bracing for a potential for having more flu than previous. Nationally, what's been quoted is that there was the thought about being a 20% increase in flu activity compared to previous. And so we are watching, and this is one of the reasons that we're concerned about where we are in the upcoming fall winter, because we are worried that you are going to see, especially if people don't wear their masks in certain settings, including around people indoors. The concern that we have is that they're going to be at risk, not just for COVID-19, but also for other respiratory diseases. So just the overall comments there. And then Dr. Kwanget, if you wanted to add anything there.
Yeah, thanks. That's a very good question. And I don't have historical data for respiratory virus activity compared to this season at my fingertips, and perhaps that's something we can follow up on. But I can say that as a pediatrician seeing patients in clinic, my partners and I are seeing more respiratory viral infections in children this fall than last fall. And because of this, we anticipate that there will be much more flu activity this season than there was last season, and which means potentially greater stress on our healthcare system, which, as I mentioned before, makes influenza vaccination so important this year to reduce the possibility of overwhelming our healthcare system.
And just a reminder, last year that at this time we were also having children not in person for schools, and so there's also now been an increase of gathering for kids in schools, and again, indoor masking requirements, which we want to thank again our school system and our parents and the kids, because they've really done a remarkable job of wearing masks indoors. But again, you're getting on the bus, or you're gathering outside of the school, and you're in a setting where you can have an increase in transmission, and that certainly not just applies for COVID-19, but also other respiratory viruses. So we'll keep watching that, and as Dr. Kwanget said, Kate, we can try to get some. Sorry, that wasn't Kate that asked the question. Our colleagues at Seattle Times, we can get some more information to you.
Thank you. I did get in touch with Kate. She's having some mic trouble, so I'm going to ask the questions on her behalf, and there are two of them. The first is, can you please tell us how much demand you're seeing for the 5 to 11 vaccine and whether that demand differs from county to county?
Michelle?
Yeah, that's a great question. And, data is pretty preliminary, and we could follow up offline with some of the numbers and different ways we could look at that, including ordering data and others. But overall, I can tell you is that the early signs do indicate that demand may differ by region, kind of similar to what overall vaccination rates look like by region. So an early looking at vaccine and the reason why I say it's pretty preliminary because there is a data delay. And so I don't think we can be fully confident we've got all the data reported to the state yet. But when we look at the information, we're seeing variation by region in doses administered, with kind of some of our central parts of the states at the lowest area at 2 to 3%. And then the highest area would be the Puget Sound region at over 12%. So that kind of fits where we're seeing high points across the state with just overall vaccination rates and where there is some lower. And what really just overall, what concerns us with variation in vaccination rates is that leaves those communities way more unprotected. If we had, I shared the great news about reaching an overall 80% vaccination rate for age 12 and older, which is fantastic, but that is not divided evenly across the state. And it's not even divided evenly in counties that have some of the highest rates. There's variation across counties and there's variation within counties. And any community that has a lower rate has a much greater chance of having COVID outbreaks. And we're seeing that in our outbreak data and other places. So I'll just add at the end, getting close to closing, that, COVID illness continues to be driven by people who are unvaccinated. There's many, and the people who are in the hospital and others is one of the drivers, and you are at much greater risk of severe illness, of getting COVID, or of being hospitalized if you're unvaccinated. So that's why we continue to share the message that the best protection you could do for yourself is to get vaccinated, especially coming into the winter holidays and just more time indoors, and really to keep our businesses open and to keep our schools open and safe. We really would encourage everybody to make sure you have good, accurate information. And you can do that on our website, or you can talk to a healthcare provider or a community leader, but it's really important to still consider the benefits of being vaccinated.
And Michelle, her follow-up question, I think you touched on, but I want to do right by her and ask it. You mentioned lags in certain communities or geographic areas, and her question was, what do you know so far about how equitably the vaccine for that age group is being distributed? So is there anything else you'd like to add?
We don't. It's really too preliminary and too early to be looking at our data by race, ethnicity, since some of those populations have very small numbers. But I'm hoping that by probably the middle of December or stuff, we'll feel confident enough that we have enough data. We're not dealing with reporting delays to really look at some of the trends in the 5 to 11-year-old vaccination.
Thank you very much. Let's go now to Dr. Shah for closing remarks.
Thanks, Julie. First of all, thank you, Julie, for moderating. I think last time I forgot to thank you, so I wanted to make sure that I didn't get in trouble again after the briefing. I want to thank you and our team behind the scenes that always help us make sure that we are able to have a successful media briefing. I also want to thank our media partners, again, as always, for joining us every week or every other week, or as we schedule these. And finally, I want to thank Washingtonians for what they have continued to do throughout this pandemic, not just with respect to vaccinations, not just with respect to masking, not just with respect to hand washing, not just with respect to staying out of large gatherings, not just with respect to, and I can fill in many, many, many blanks. But I just want to say thank you for everything that you have done to get us to the point where we are seeing progress and we are hopeful for the future. But we have to hang on. And this is a time to get a booster if you're eligible, and certainly to really recognize the importance of vaccines for those who have just not even gotten their first dose. We have gotten people in our state that are getting now their third doses of vaccines. And yet we also have people in our state that have not even initiated vaccinations. So we want to encourage everybody to get vaccinated, including our kids. I'm excited about joining my kids tomorrow, 2 boys, to get their pediatric doses. I know many in our team have also had seen their kids get their vaccines recently. And I know it's for us as parents, my wife, myself, this is such great, amazing news for us to be able to get our kids protected. So now the entire family is protected. And it's just a reminder, with Thanksgiving and gathering and travel right across the board, we want to make sure we do everything we can to protect ourselves and each other. Take the advice of a pediatrician, Dr. Quan Get, reminded all of us of why COVID vaccine is so critical, but so is flu vaccine and all the other protective measures that we need to take. And finally, you can get verified through WA Verify. Again, the formal launch of that will be next week, but you can get a sneak preview of that. So thank you, Les, for your leadership on that. And I would be remiss if I did not close with just our thoughts and prayers go out to those who have been impacted with the weather events this past week. We know that while it may be sunny outside right now, that people are still going through some incredibly, tremendously difficult times. And we want to make sure that we are supportive of each other, and certainly want to thank Andy and his team for everything that they have done to help us throughout this process. So again, thank you. Please have a great Thanksgiving, safe Thanksgiving week, holidays, and we are looking forward to visiting with you again after the holidays, so that you do not have to hear us on Wednesday of next week, but right after the holidays, we hope to gather back. And with that, Julie, we'll turn it to you to close.
Yep. If anything comes up before then, you know that we will make ourselves available to you. But otherwise, our next scheduled briefing is Wednesday, December 1st. Have a happy Thanksgiving, everyone. Bye-bye.